Hello, Namaskar and good morning to all. Myself Ajanta Singh, registered nurse and a lecturer in Maharajgunj nursing campus. Working as a clinical supervisor in Tribhuvan University Teaching Hospital, I noticed frequent staff turnover in the ward. Despite being highly paid nursing staff among the hospitals of Nepal, the rate of discontinuing the job by the nurses was terrible, leaving the patients always the instrument to be practiced. It stuck to my mind and I decided to measure the satisfaction level of the nursing staff. Nurses have an important role in determining the efficiency, effectiveness, and sustainability of healthcare. So, nurses' job satisfaction plays an important role in delivering quality healthcare services. For that, ethical approval was taken from the Institutional Review Board of the Institute of Medicine. Administrative approval for data collection was taken from Tribhuvan University Teaching Hospital. A permission letter was submitted to the in charges of each ward. The purpose and objectives of the study were explained and informed. Written consent was obtained from each respondent. Confidentiality was maintained by not disclosing the name and responses. The anonymity of the responses was maintained by keeping code number instead of their name. Respondents were not forced to participate in the study. All these procedures are to be followed to protect human rights and follow research ethics. As it was just a descriptive study, all these procedures were conducted easily without any errors. In our context, it is easy to get ethical approval as far as ethical principles are followed. Indeed, it takes some time, but not that much problem is faced in this procedure. It is important to get ethical approval as well as administrative approval to protect the participant and administrative approval for validation. It demonstrates respect and adherence to local procedures and regulations and also contributes to strengthening local oversight capacity and in turn opens the door for the cooperation of local authorities and most importantly creates an environment where respondents feel confident, protected and more likely to provide the honest answer. The findings of the study revealed that more than half of the respondents were satisfied with their jobs and more than half had high intention to leave their job despite their dissatisfaction. It was also found that the most satisfying domain was salary and benefit, and the most dissatisfying domain was lack of personal growth and involvement in decision making. After the study, I got the chance to disseminate the findings to the hospital administrator. The management team asked me, "Yes, you have found the problem. Now tell me what you can do to solve that problem." Then I came to know that my study was incomplete. I just found out the problem. The management only listened and no actions were taken. Their lack of involvement as well as ownership of the findings and was not governed by the concerned institution. So the lacking part of my study was community engagement, collaboration, ownership and benefits to the respondent. Although it followed the principle of doing no harm, the respondent did not benefit it at all. It lacked involvement, participation, engagement and collaboration and indeed lacked social and policy transformation which the actual research should have. Thank you.